Now to a health alert. The FDA, the CDC, and the Florida Department of Health are now investigating a Listeria outbreak linked to ice cream. Big Olaf Ice Cream, a Florida-based creamery, has been connected to 23 reported infections. That ice cream is sold only here in Florida, and health officials are concerned it is still being sold and still being consumed. Dr. Shalika Katugaha is a system medical director for Baptist Health and is joining us this morning. Good morning. Thanks for being with us. We appreciate it.
Thank you.
So what is Listeria? We hear about it all of the time.
Listeria is an infection that you get by eating contaminated foods.
And any idea how it gets into the food? I mean, is this a cleanliness issue?
So it certainly can be. So Listeria is all around the bug that causes it. It's in soil, rotten vegetation, our, water supplies that are not clean, but it can also be acquired by unsanitary manufacturing and processing and unsafe preparations and handling of food.
So that's probably what's being investigated here at the manufacturer of this ice cream to see if something must have obviously gotten into the system that caused this outbreak. Or how it got into it. All right, what are the symptoms of it?
Sure. So you can have fever, chills, and then a GI illness. So nausea, vomiting, stomach upset, diarrhea. You can also have headaches or muscle aches. And then in more severe cases, you can have loss of balance, confusion, and convulsions.
What is always difficult about those kinds of symptoms, particularly the ones that you mentioned initially, is that could be related to maybe the flu, it could be a stomach bug, it could even be associated perhaps with COVID-19 symptoms. What's the best, if you develop this, because some people just wait it out? I mean, is this something that if these develop, you need to call the doctor right away because there's some kind of treatment for it?
Yes, and actually, in general now, in our age, we should always be calling and letting our provider know symptoms. So our provider can figure out if you have Listeria based on your symptoms, and then after that, it's a simple blood test that they can do to test if you have it or not. And then, it's certainly treatable if you have symptoms and fever and illness with antibiotics. So absolutely let your provider know.
Is there a certain segment of our population that is more at risk of getting really sick than others?
Yes, so there are certainly high-risk groups. So these high-risk groups are anyone with a weakened immune system, anyone over 65, and pregnant women and their unborn babies.
Oh, well, it makes sense. If you eat something contaminated, how long does it take for the symptoms to begin to appear?
Sure. So if you just have the fever and the gastrointestinal symptoms, they can show up in 24 hours of eating the contaminated food. But some of these more serious symptoms can take up to 70 days to show up.
Oh, no. So it would be difficult because if you find this in your freezer, for example, or many of the people who were sickened actually are travelers, so they ate the ice cream and then went back to their state, it's hard to pinpoint perhaps where you got the infection or if it is Listeria to begin with.
That is exactly right.
70 days. Oh, wow. Okay, so if someone discovers then that they had this contaminated, ice cream, what should they do then?
They should monitor and be very vigilant for symptoms and then let their doctors know.
Doctor, thank you for being here. We really appreciate it. Is there something that we can do to avoid this, by the way?
Yes, actually. Yeah. So these, listeriosis is actually preventable, and many of these food poisoning illnesses are preventable if we heed food safety and, watch our protocols. So my tips for all of you. So if you're eating leftovers, heat them, make sure they're hot. When you store them in plastic or foil, and store them within 2 hours and eat them within 3 to 4 days. Make sure the juices from meat don't get on other food. Wash your hands properly. Please cook all deli meats, hot dogs, egg dishes, seafood. Make sure that all your dairy is pasteurized. And finally, pay attention to the media. And you can go on CDC's National Outbreak Reporting System as well to make sure that you know what food is safe and what has been recalled.
Well, you bring up such an excellent point because we tend to think that we might be exposed to this through other sources, but the reality is this could be something that develops in our own refrigerator, and there are safety tips that we can follow so that we prevent that from happening. So thank you. Make sure you cover it. Sometimes I'll open my fridge and my kids have left the tin foil or whatever off. I'm like, oh, now it's smelling up in the fridge, and now it's prone to Listeria. So thank you for your time. We appreciate it.
Thank you.